Welcome to the HEOR Insights YouTube channel.
In this explainer, we're going to cover the choice between fixed effect and random effects models in a meta-analysis. This is a really critical skill for anyone in health economics and outcomes research. We'll start by defining the models, then use an analogy to build some intuition. After that, we'll look at the mechanics, walk through the decision framework, show the impact on your HEOR work, and then wrap up with a summary.
So the choice between a fixed effect and a random effects model, this is really the main statistical decision you have to make in a meta-analysis. It's fundamental because it dictates exactly how you're going to combine the data from all of those different studies.
First up is the fixed effect model. Now, this one operates on a pretty strict assumption, that there is one single common truth that all the studies are trying to measure. So any variation you see between the results of those studies, the model just treats that as random noise or sampling error.
The random effects model, on the other hand, sees things differently. It assumes that the true effect isn't just a single point, but is actually a distribution. It accepts that the effect size can, and probably does, genuinely differ from one study to the next, maybe because of different patient populations or slight variations in study design.
So why is this choice so important for our work in HEOR? Well, it directly hits our key outputs for Health Technology Assessment or HTA submissions. It changes the final pooled number, the point estimate, that goes into our economic models. It also changes the confidence interval, which is what drives our sensitivity analyses. And get this wrong, and you could face some serious pushback from regulatory bodies.
To make this a little clearer, let's step away from the math for a second and use an analogy. This should really help clarify the core philosophical difference between these two models.
Think of each study as an archer. In a fixed effect model, we're assuming every single archer is aiming for the exact same bullseye. Our goal is just to figure out where that one single bullseye is located. But in a random effects model, we assume each archer is aiming at a slightly different target. So our goal isn't to find one point, but to estimate the average location of that whole group of targets.
All right, let's get into the mechanics. The mathematical difference between the fixed and random effects models, it actually all comes down to one thing: how the weight of each individual study is calculated.
Both models are built on a foundation called inverse variance weighting. That's just a fancy way of saying studies with less variance, so more precise studies, get more weight. The fixed effect model is simple. The weight is just 1 divided by the study's variance. The random effects model adds an extra piece of the puzzle, a term called tau squared, which is the variance between the studies.
So what does adding this tau squared term actually do? Well, by adding this constant value to every study's variance, the random effects model makes the weights more even. It flattens the differences. This is really important because it prevents a few massive studies from completely dominating the result, and it gives the smaller studies more of a voice in the final synthesis.
Before you can even choose a model, you have to do your homework. An analyst needs to formally assess something called heterogeneity. In simple terms, that's just the degree of statistical disagreement between the studies you're including. You can assess heterogeneity in a few ways. You can do a visual check just by looking at the overlap of confidence intervals on a forest plot. Or you can get more quantitative with statistical tests. There's Cochrane's Q, and maybe more commonly, the I-squared statistic, which tells you the percentage of variation that's likely due to real differences between studies, not just chance.
But here's the thing. The modern best practice in HEOR, which is guided by groups like ISPOR and Cochrane, tells us not to just rely on these statistics. We need to prioritize clinical and methodological similarity. Basically, if your studies have different populations, interventions, comparators, or outcomes, a random effects model should probably be your default choice.
The choice you make here isn't just an academic exercise. It has very direct, very tangible consequences for the core deliverables that we submit to payers and regulatory agencies.
Think about your cost-effectiveness models. The pooled estimate from your meta-analysis is what you use for key inputs like transition probabilities. And the random effects estimate is often preferred here because it's seen as more generalizable. By factoring in the variability between studies, it gives you an average effect that isn't overly dependent on any one study's specific population.
And this is crucial. The random effects model almost always produces wider confidence intervals. Now, for something like a probabilistic sensitivity analysis, or PSA, this is exactly what you want. That wider interval leads to a more conservative and frankly more realistic picture of the decision uncertainty, which is a key thing HTA bodies are looking for.
Okay, let's wrap this up by summarizing the key distinctions between these two models and giving you the standard industry recommendation.
So, here's the side-by-side. The fixed effect model assumes one true effect
only considers within-study error, gets dominated by big studies, and gives you narrow confidence intervals. The random effects model assumes a distribution of effects, incorporates that between-study variance, has more balanced weights, and produces wider, more conservative intervals. And for all those reasons, yes, it is the default choice in HEOR.
For your HTA submissions, the random effects model is the standard. It just aligns better with the messy reality of clinical trials and real-world data. It acknowledges that studies are not perfect copies of each other, it respects the complexity of the evidence, and it gives a more honest and transparent assessment of uncertainty.
So, in the end, the choice really boils down to this one question you have to ask yourself. When you look at the variation between your studies, is it just random noise, or is it a meaningful signal that reflects true differences that you absolutely must account for in your model? Answering that question is the core task for any analyst justifying their model choice.